Hi everybody, welcome to week 2 of Seminar 2. Great first week, you guys. Even though we are a small class, you guys had great participation. I really liked your ideas and your thoughts, and I think we're going to have a good 7 more weeks together. All right, so we're in week 2. Let's just take a look at the objectives for this week. Evaluate teaching strategies to promote critical thinking. Explore methods to evaluate learning in one of the following modalities: classroom, clinical, or sim lab. So that's kind of the overall focus for this week. There's a few areas I do want to touch on. So one of them is test creation. Test creation is really it's really a skill to write a really effective test. All of our pieces have to hang together. Our objectives, our curriculum, what we say we're going to evaluate, our outcomes for the program. There's just so many things that need to tie together. I tell all of my students the best resource you can get, and you're probably seeing this backwards, but it's this book, The Nurse Educator's Guide to Assessing Learning Outcomes, Edition 3 by Mary McDonald. Mary McDonald is the testing guru, and she presents everything in a very easy to understand format, and she really shows you how to tie first of all, create the objectives, and then writing your questions to match those objectives to get at what you really want to get at with a test question, formatting the exam, and then evaluating your exam results up to and including statistical analysis. So that's a wonderful book, and I will put the reference on that in this post. So just a little hint on that. So evaluation strategies. We know that our evaluation strategies are going to depend on our objectives, right? And in week 1, we talked about cognitive, psychomotor, and affective. And our strategy is going to depend on which of those our objective is tied to, and within those, what level. So are you asking your student or staff member to identify? Are you asking them to analyze? Are you asking them to apply? The way that you format your objective is going to determine the way that you need to format your evaluation strategy. Okay? All right. So we'll be looking at those this week. This morning, I had a great webinar on concept mapping. I love concept mapping. I really have fun with it. So for those of you who may not be familiar, there's a little bit of information in your book about concept mapping. I tend to use concept mapping both for teaching strategy. I also have had students use it for care planning instead of a very lengthy care plan document. So let's say that I am doing a class period on diabetes. It's something I like to teach about. Anyway, I'm doing a class period on diabetes. And I want to start the class on getting people thinking about diabetes as a holistic disease state, okay? So maybe I'm up in front and I'm on a whiteboard. I put in the center of my circle and it says diabetes. And now I want my students to tell me different factors that are going to affect a patient with diabetes. Anything. So I'm going to start drawing spokes off of my center. And maybe they're going to tell me, maybe they're going to tell me medications like insulin. Maybe they're going to tell me diet, maybe skin, feet, cardiac. There's so many different psychosocial, self-concept. There's so many things we can think about. But I want to do a brainstorming and get all these things kind of fleshed out to start with. And then I want my student to start to make linkages. What do we have to monitor? What do we have to teach about? What are we looking for complications for? And to start to make this map expand about looking at diabetes in a holistic manner. So that's one way to use it. And let's say we're going to use it for care planning. In the center, I'm going to put 48-year-old female status post hysterectomy for carcinoma. And then my students are going to draw lines out, and maybe on the line, they're going to write 2 findings, maybe, and then they're going to have more bubbles with the nursing diagnoses, and then they're going to have lines of bubbles coming off of that for nursing interventions, individualized to this particular patient, not copy and pasted out of the nursing care plan book, but actually individualized to this patient. So there's a lot of ways that we can use concept mapping. I know some of you touched on it a little bit in week 1, but I was just reminded of its greatness at a webinar this morning. Okay, couple more things. We're almost done. CLCs, your learning groups. We only have 7 students in class, so there'll be a group of 4 and a group of 3, and hopefully I'll be posting that either tonight or tomorrow. Because you do have, at the end of the course, you're going to be making a case study in your small groups, and I'm a big case study fan, so I'm really glad that you're getting some hands-on experience with that concept if you've never used it before. All right, and then finally, this is important, week 7, your personal class design project that you started previously, I think in seminar 1, and now you're going to be expanding here, I think it's week 7. I need you to send me a note in your individual forum and let me know what the topic is for your project, for your class that you're designing. I just need to get an idea of what you're going to be focusing on, okay? So we have a lot of big projects kind of coming up towards the end of the course, not so much right now. So I would really encourage you to pull out that class project from, I think, seminar 1 and start looking at that. And then as soon as I post the CLC groups, you might want to start brainstorming on at least a topic area, something, just to kind of get the wheels spinning about what type of case study you're interested in. Okay, so I am excited about our topics for this week. I'm looking forward to talking with you in the main forum and discussing these things. And I think that's about it. I'll see you in the main forum.